Welcome and thank you for joining us. Our short webinar today is all about solutions for the member journey with a focus on how best fit plan analytics impact star ratings. I'm Kara Tarantino, Director of Marketing with ConnectSureDRX, and I'm delighted to introduce our presenters today, Amanda Woodman, Sales Executive for our Health Plan Market segment, and Arthur Tu, Director of Product Management, both with ConnectSureDRX. We value your time and will follow up with any questions you may have after the webinar, as well as send you a copy of the recording. Please type questions in the box here or send them directly to marketing@connectsure.com. And with that, Amanda will get us started.
Thanks, Kara. We'd like to kick off our webinars with a brief intro to ConnectSureDRX for those of you who may not be familiar with us. We have more than 20 years of experience developing innovative and scalable solutions for Medicare. Our experience includes working with those who are brand new to selling Medicare, as well as industry veterans. We work with the largest FMOs and some of the smallest agencies, as well as over 70 health plans. We also have the largest distribution network in the Medicare industry. ConnectSureDRX has a vast history of collecting data that has provided valuable insights over the years. And this data is a part of our robust analytics platform, a vital component to helping our customers connect with their end user audiences faster and more effectively. We have learned that combining data and personalization along with speed of service is the game changer for retaining Medicare beneficiaries. And our proven retention strategies enable our customers to create personalized messaging that leads to brand loyalty, even when members undergo unforeseen changes in their insurance coverage. We also pride ourselves on being the gold standard in the industry for drug pricing. And many of you may already rely on us for our pricing expertise. In fact, we are often quoted and used as a primary reference source in publications when the most accurate drug costs are required. So today we're focusing on the Medicare member journey and the solutions for each stage in the journey. These solutions help health plans improve their member experience by managing their pain points. So let's start by taking a look at the future. By 2060, according to the US Census Bureau, 95 million seniors will be eligible for Medicare, nearly a 70% increase in the number of those eligible for Medicare today. And what we see is that Americans aren't just aging, they're living longer with multiple chronic conditions. In addition, health plans have pain points related to their goals in achieving outcomes based on quality, performance, limiting disenrollment, and improving the customer experience. These are all factors that feed into a health plan star rating. And as we know, star ratings really do matter. 90% of MAPD members are enrolled in plans with 4 or more stars. So when health plans lose a star, this becomes an opportunity for other health plans to pursue new members aggressively. And disenrollment is a true pain point for health plans. Star ratings are the highest they've ever been, due primarily to the unprecedented impact of the COVID-19 pandemic. The number of health plans with a 5-star rating are in abundance for 2022. 60 plans now have a 5-star rating in 2022 that did not have this distinct designation in 2021, which is a 192% increase. And nearly 70% of Medicare Advantage plans now have 4 or more stars. In addition to the COVID-19 effect, health plans have made strides in providing better access to medications, focusing on clinical care for chronic conditions, and optimizing the member experience. But they can't stop here. As high as star ratings are for 2022, 2023 is setting up to be a whole other story if health plans don't continue to invest heavily in that member experience. So in the next slide, we're going to dive a little deeper into how health plans can continue to improve the member experience by focusing on the role of agents and understanding the significant impact they have on star ratings. A recent Kaiser study showed that in 2019, 71% of all Medicare beneficiaries did not compare plans during open enrollment. This rate jumps to 85% for those with lower income and less education. And about 50% have never even visited the Medicare.gov website. And as we know, agents influence plan selections. 96% of MA and PDP plans contract with agents, and agents are not required to present all available plans. As the face of Medicare plans, how agents interact with members can impact the plan performance. Costly disenrollments can be avoided by improving an agent's ability to connect members to the information and support the need, and assisting members at every touch point in the member journey. So here's how agents can most effectively impact star ratings. So first, ensure all the information is accurate on the enrollment forms. Stars are impacted by the member experience and the perception of care received via CAHPS surveys. They can thoroughly explain benefits and out-of-pocket expenses. Stars are impacted by members switching plans and disenrolling. They can discuss scheduling wellness exams with PCPs, also explain that the health plan may reach out occasionally to assist with preventative care needs and to handle medication reconciliation. Stars are also impacted by annual screenings. And then if applicable, encourage members to complete a health risk assessment. Star ratings are based in part on annual screenings and medication adherence, and stars are based on specific services. And help reduce complaints by adhering to what is required in all sales appointments, because stars are also impacted by complaints. So now I'd like to call attention to some key challenges of the member journey where health plans have control when they implement the right solutions. These are solutions that can positively impact star ratings. These challenges include medication adherence, the customer experience in CAHPS surveys, and the best fit plan match. So let's look at medication adherence first. Affording medications and taking them as prescribed is difficult for seniors. Unfilled prescriptions lead to increased risk of patients going to the ER, along with the chance of costly hospital readmissions. So medication adherence is absolutely critical to star ratings. With the increase in weighted star measures for medication-related behaviors, improving medication adherence goes beyond simple reminders to refill a prescription. According to the American Journal of Managed Care, the CMS rule on improving medication adherence will have a direct and near-term effect on the health plan's star rating. This rule also emphasizes using engagement tools to keep members in network and reduce their out-of-pocket expenses. Customer experience. So Medicare Advantage is growing quickly, and in fact, it's the fastest growing business line of business for many health plans. How members engage with their health plan is also reflected in star rating. Since the consumer experience is now a business and performance imperative, the weighted measures for experience have increased to 50% of star ratings. Member experience and complaint measures are quadruple rated this plan year. And for plan year 23, these measures will account for 54% of ratings, shifting the scales over all other measures. And CAHPS surveys. So CAHPS surveys ask members questions about their experience or their perceptions of the level of care they receive from their providers and health plans. Half of the experience measurements are determined by CAHPS questions, and CAHPS surveys contribute to 32% of star ratings. And then lastly, the best fit plan match. One of the best ways agents can help build trust in a health plan is to work with beneficiaries to get them in their best fit plan from the start. Shortly, we will dive into some interesting analytics that will show you how health plans and FMOs are encouraging members to compare plans by presenting them with their top 3 best fit options. And our best fit plan analytics, or what we call PlanSmart, helps demystify Medicare and clears away a lot of the confusion when beneficiaries are overwhelmed with too many plan choices. So the right data that includes accurate plan cost and drug data points points them to the right options and goes a long way towards improving informed decision-making. So now let's dive into the solutions that will help agents and members get on the right path quickly. So now that we've seen a few of the tough challenges health plans face, we're going to uncover the solutions critical to ensuring the members are connected to their health plans at each point in the member journey. So the solutions that will ultimately help deliver higher star ratings. If a health plan cannot hold a 4-star rating, members switch to a higher rated plan. And as we mentioned earlier today, there are more plans with 5-star ratings than ever before. When health plans lose a star, this is an opportunity for other health plans to aggressively pursue those members. So to avoid the pain of disenrollment, we need to pay attention to innovative solutions that drive members into their best fit plans sooner than later, so they can build loyalty to their carrier. So here we see 3 stages in the member journey: acquisition, engagement, and retention. Below each stage are the targeted solutions that we're going to discuss. So stage 1 of the member journey is acquisition. Our 2 solutions that impact acquisition are PlanCompare One and BrokerLink. Acquiring members is all about establishing connections. It means using your existing channels, whether they be direct consumer, call centers, field agents, or e-brokers, to increase awareness of your product offering and to get more eyes on every plan. Our PlanCompare One platform is for digital Medicare shopping, quoting, and enrollment. It drives increased enrollments across all distribution channels with easy-to-use innovative tools. And our extensive BrokerLink distribution network allows health plans to maximize plan exposure by connecting health plans to as many agents as possible, thereby driving higher health plan enrollment volume without having to pay for more increased access and connections. BrokerLink is important for health plans to make sure they get as many eyes as possible on every plan, and this is especially important during the short 7-week window of AEP. So let's dive a little deeper into PlanCompare One. PlanCompare One is the digital platform of choice for many health plans, FMOs, large agencies, and financial services organizations across the country. We call it the One digital solution because of its key benefits, including a highly configurable platform available as a hosted solution or via API. Supports all Medicare plan types, including MA, MAPD, PDP, and MedSup, along with ancillary products. And provides tools for all channels, including broker, call center, and direct consumer, as we mentioned previously. Agents are also heavily invested in their personalized shopping URLs that they get from Kaiser. We see a lot more unassisted enrollments on the sites that use pearls or shopping links. Our direct consumer sites can be linked to any Kaiser call center or broker site, so information is easily accessible to the agents, making the process for the consumer more streamlined. And personalization through preferences. Consumers and agents can personalize the member experience by adding member health status, low-income subsidy status. They can see if providers are in network. They can look up pharmacies via our multi-pharmacy options, add their drug lists, and more. And lastly, decision support. Gold standard drug pricing, reliable out-of-pocket estimates, and connections to Medicare.gov to automatically download a medicine cabinet is key to informed decision-making. And BrokerLink. BrokerLink is really an unparalleled opportunity to make connections you wouldn't otherwise be able to make. This vastly connected network has caused Medicare enrollments to more than double in the past year. With nearly 200 carriers in the network and hundreds of thousands of agents with access to these carriers in all 50 states, we're making connections like never before. So here's how it works. The health plan chooses the FMO and agencies they're contracted with in our network. FMOs choose the carriers and products they're licensed to sell. And through a single integration point on PlanCompare One, we offer a gateway for FMOs to access these carriers on one platform. Agents are able to connect with more consumers online every day, and then consumers are able to enroll in their best fit plans. Health plans receive their enrollments from one integration point from all of their chosen partners. And carriers also benefit from working with Kaiser. We verify all permissions and load carrier plan pricing and formulary data as necessary. And we also configure enrollment forms to include carrier branding and any other specifics unique to that carrier. So now Arthur will take over and talk about the next stage, which is engagement.
Thank you, Amanda. Once a member has been acquired, health plans shift to going beyond actions to focusing on engagement strategies. These may involve proactively connecting with those targeted members who offer the best chance of making necessary behavior changes. Offering insights and analytics across a spectrum of member behaviors, health plans can nurture the member in their first year and beyond. We look at proactive member engagement strategies and tools like our Database RX therapeutic interchange solution, where we offer pharmacy data that allows health plans to direct members to lower cost alternatives they can speak to their prescribers about. Lower cost alternatives drive higher medication adherence, which ultimately leads to improved health plan performance and elevated star ratings. Dive a little deeper to show how Drug Compare and Database RX work together to drive higher levels of engagement to help members improve their medication adherence. Database RX is a therapeutic interchange database. It offers drug options beyond brand names, direct generic alternatives, and generics. It is also a powerful analytics tool that provides the pharmacy data that health plans need to connect members to better, lower cost alternatives. When we say better, this may refer to medications that have fewer side effects or less frequent dosing schedules in addition to being lower cost. Database RX holds over 42,000 active NDCs in 140 drug classes. This is one of the most comprehensive therapeutic interchange databases that health plans and PBMs have relied upon for more than 20 years. To give you an idea of the savings potential of this database, we analyzed 8.7 million prescription drug claims for drugs on the CMS formula reference file. And we found that 32% of them had lower cost options in our database, a savings of $219 million. Health plans and PBMs develop member outreach programs to inform members directly about how they can reduce the cost of their prescriptions. These direct-to-member communications encourage members to speak to their physicians about the alternatives or direct members to do their own research on Drug Compare, which is typically housed on a health plan website. If even a small portion of the targeted members make the switch, the savings can be substantial. This insight is key for improving medication adherence, strengthening the relationship between members and their health plan, and building future strategies for new plan designs by using our pre- and post-claims data reporting. Here's an example of the potential savings, and to also stress that direct generics or any kind of generic is not always the lowest cost option. It is important to look at the differences in price. Here we averaged out the cost per unit for different brand and generic drugs using CMS retail pharmacy pricing. These costs represent what health plans are paying for these medications, a portion of which is then passed on to their members as copays or coinsurance. The average Medicare cost of EpiPen is $310 per unit. Its direct generic epinephrine is $161, a 48% savings. Our Database RX houses a brand alternative option called Synjepi at just $133, which is a savings of over 57% off of the brand. One of the biggest factors affecting star ratings is disenrollments, something all plans want to guard against by having a proactive member retention strategy. This includes identifying members who are at risk of leaving the health plan long before they actually do. Earlier, we mentioned that getting members on the best fit plan from the start is important to ensuring members are engaged and satisfied as they stay with your brand for life. The solutions we offer for the final stage of retention include our PlanSmart Predictive Analytics and Medicare Retention Suite. Identifying at-risk members early is key to protecting against disenrollment. At-risk members can be affected by a plan discontinuation. They may also be members who did not find their best fit plans from the start, as well as members impacted by a plan sunset or formulary change, among others. PlanSmart provides the visibility you need to retain your members year over year. Through comprehensive analytics like demographics, current plan utilization, and pharmacy data, plans can segment their customer base for more targeted and personalized marketing initiatives. Here are the reports that we provide via PlanSmart using health plan, PBM, and pharmacy data. These reports look at first-year members in January of every year to support rapid disenrollment campaigns, analyze changes in prescriptions or plan coverage to see where risks lie, and even look at commercial members to identify where their best fit plans may be. These reports can yield results important to protecting health plan membership. Now here's where it gets really interesting. We have been working with a customer over the past 2 years using PlanSmart Analytics to demonstrate the top 3 best fit plan options for each member based on their personal profile, including drugs, pharmacy, and health status. Here's what we uncovered. 30% were in their best fit plan when total drug costs were taken into consideration, and 60% of members were already in one of their top 3 plans. If a member was not in one of their top 3 plans and they switched to one of those plans, they could potentially save on average $1,300 a year. For a member with 10 or more drugs in their medicine cabinet who was not in one of their top 3 best fit plans, the savings was on average $3,300 per year if they switched. There were roughly 16,000 members, or about 3.2% of the customer's membership, that fell into this scenario. There was a potential savings of $58.2 million if all these members moved into one of their best fit plan options. So how do we know PlanSmart works? In 2020, we ran an analysis of our 500,000 members and found that on average, if members switched from their current plan to their best fit plan, they would save about 28%, an average savings of $523 a year. In 2021, we did a similar analysis, and the data showed that 16% would benefit from switching their best fit plan. The 8% drop showed that thanks to PlanSmart, more members made the switch to their best fit plan from the prior year, so the number of individuals needing to switch actually dropped. A best fit plan analysis would not be complete without adding in drug costs. Drug costs are critical to determining annual out-of-pocket annual costs. A recent New York Times article discussing the study we mentioned earlier started out with a perfect example of a beneficiary looking for a new plan because her current plan was being discontinued. The prices shocked her, but also the fact that she had 23 plans to choose from with a wide-ranging cost was just disconcerting. She asked for guidance to help sort through her options. She compiled a list of her 8 medications and with assistance narrowed down her selections to 3 plans. She compared prices at different pharmacies and mail order and looked at out-of-pocket annual costs. She ended up selecting a plan that will cost less than her previous plan. Members can save $1,000 a year alone just by going to multiple pharmacies. This is something so important to our customers, we have added the multi-pharmacy feature to our Plan Compare One platform this year. The point we want to make here is that adding in medicine cabinet lists is important to a best fit plan match. In getting back to our analysis, we see that 56% of members were in their top 3 best plan matches, but only 19% are in their best fit plan once drugs are concluded. There's a lot of room for improvement here, but with PlanSmart, our customers know exactly what they're dealing with and can take the next steps to proactively connect members to their best fit options. This slide demonstrates where some of the savings can be found when drugs are taken into account. A member that is on one drug can save over $217 a year by switching. More than 36% of the members in our analysis fell into this category. 32% were taking 8 drugs, and they could save on average $1,000 a year by switching. And those taking 17 drugs or more could save almost $2,500 a year by moving into their best fit plan. PlanSmart works in tandem with our Medicare Retention Suite. The Retention Suite offers a more personalized enrollment experience when demographic, drug, and current plan data information is readily available. This data has proven to increase efficiencies across enrollment channels. For example, call center agents have been able to reduce call times when this data is available on their platform. Personalized member messaging is important to every retention strategy. If a member faces a prescription, formulary, or plan benefit change, or even transitions from a commercial plan, messaging can be tailored to ensure the member knows their options moving forward. This not only improves the member experience, but also reduces the chance for switching outside the health plan brand. And now back to Kara to wrap things up.
Thank you, Arthur and Amanda. And we thank you for your time today. Please also download our Health Plan Solutions white paper called Elevate the Member Experience and Improve Star Ratings. It can be found on the Thought Leadership page of our website at Connecture.com. And if you'd like a demo on any of our solutions or have any questions, please reach out directly to us at marketing@Connecture.com. We look forward to seeing you on a future webinar. Thank you.